This is the slide that basically summarizes everything we're going to do today in its framework. And again, since you are professionals, if you want to read the science behind this, please read The Developing Mind, and you'll see this. If you want to see how to apply this in your life as a parent, read Parenting from the Inside Out. If you want to see how to apply this idea to yourself as a therapist, The Mindful Therapist teaches you how to develop integration in your own life. If you want to see how to develop this for clients or patients, the book Mindsight shows you how to do that. If you want to see how to develop integration for yourself as a parent of an adolescent or as an adolescent themselves, read Brainstorm. So basically, all these books are about integration, but the idea is, how do you apply it? What's the practical use? So the Whole Brain Child takes it and says, well, what would be the basic approach of a integration as a parent? What would you do to try to have integration be your theme? So the reason it's so important, you can see, is that when integration is present, you're in a state of harmony. It's literally like a choir, where the choir can have differentiated voices, but they link together in a common song. Right? Now, the choir gives you that feeling of vitality and energy. How would you describe that scientifically? On this slide, you look at this middle part, it has this quality, and I'm an acronym addict, so we put in acronyms here and there, but here's your first one for today. It's FACES. It's flexible, adaptive, and the mathematical term coherent, which means fluidly, dynamically stable. It's energized, and it has this long-term stability over it. So FACES, flexible, adaptive, coherent. You could also use the word connected if you want that. This connectedness of coherence, energized and stable, is basically what we're defining as health. And it's a way of describing the elements of being resilient and thriving. So when the system is achieving this FACES flow over time, what are its characteristics? Well, its characteristics actually are that it's linking differentiated parts. That's the amazing thing. And when it doesn't link differentiated parts together, either they're not differentiated or they're not linked, you go either to chaos, things are completely out of control, unpredictable, flooding you, intrusive, or rigidity. Things are completely predictable, unchanging, unmoving, and boring. And this is the startling finding, is that when you look at the mathematics of integration, it turns out that this is what it predicts. It's straight from math. But then if you apply it to the brain, you find that if you try to understand psychiatric disorders, for example, we're not going to talk about those much today, but if you look at the major psychiatric disorders that have been studied, every single one of them now, we've found in the last few years, has impaired integration in the brain. Schizophrenia, manic depressive illness, depression, obsessive compulsive disorder, autism, non-experientially derived psychopathology, all have impaired integration of the brain. And experientially derived impairments to well-being, like post-traumatic stress disorder, especially childhood abuse and neglect, impaired integration in the brain. So we didn't know that when this hypothesis was first set up, but it's a framework you need in science to predict what future outcomes will be. And if you turn to the DSM-5 or look at the DSM-4 or look at the DSM-3, you'll find that every symptom of every syndrome is an example of chaos, rigidity, or both. And so our take from interpersonal neurobiology is well-being comes from integration. Impaired well-being, whether it's genetically caused, infectious caused, or experientially caused, is due to impairments to integration. And then what a therapist is an integrationist. You use your relationship with your client, with your patient, to discover where chaos and rigidity exists, find the domain in which differentiation is not present and linkage is absent, and then you promote differentiation and you promote linkage. And amazingly, when you do that, health emerges. So we're doing a study now at UCLA, for example, where we're taking people with diagnosed manic depressive illness, teaching them a very integrative process called mindfulness training, and we're hoping to actually grow the integrative fibers of that person's brain. Even though experience didn't cause their bipolar illness, we believe experience can repair it. And that study is ongoing. So the idea is that even if the disorder is not caused by an experience, it doesn't mean you should just be popping pills in people. Now, medications can be extremely helpful and life-saving. But if someone has a disorder that needs a medication, maybe they also should have, in addition, a mind training program that identifies where the problem is in their brain and tries to work on repairing it with mind training. Because we now know as a fact, the way you stream energy and information through the brain changes its connections. So whether it's genes that caused you to have impaired integration in your brain, or experience, or infections, like we think is schizophrenia, or whatever, why not use the mind to support the movement of that individual toward well-being, which for us is integration. That's the whole thing.